So we're talking about health inequalities in the UK, and health inequalities are obviously the differences, usually unfair differences, in health between populations and different population groups. And in trying to understand differences in health between groups, people often focus, sometimes you'd have to say particular types of politicians often focus on individual health behaviours. So whether people smoke, whether they drink, the diet they have, as these obviously relate to proximal causes of particular diseases and poor health. But in fact, we know from research across the globe, and not just in recent decades, but arguably over centuries, that such health behaviours are governed to a huge degree by the conditions in which people live and the opportunities they have in life. This is public health research evidence. It's also common sense, frankly. So in trying to understand socio-economic inequalities in health, we have to understand what those social and economic drivers of health are. So we're talking about income and these things. And indeed, in public health research, we talk about the fundamental causes of health inequalities being inequalities in income, wealth and power. And within the UK, we don't have to look far to see examples of this. Since 1979, we've seen a dramatic change in society, a dramatic widening in inequalities in income, which over the same period has seen a correspondingly dramatic widening in inequalities in health. And that widening of inequalities in income was driven by particular UK government economic policies. So politics is really important in our understanding of this. And within research, we talk about the political economy, which is a fancy way of saying decisions at different levels of government create the environments which ultimately are conducive or otherwise to good health. So politics matters for population health, and politics matters for health inequalities. There was a famous report, well, famous in our circles, which came out a few years ago from the World Health Organization, which looked at inequalities across the globe. And there's a striking quote from that which says that social injustice is killing people on a grand scale. It's a really important and a really powerful statement. But an economist and political scientist based in America called Vicente Navarro responded to that saying, it's not inequalities that kill people as the report states, it is those who are responsible for inequalities that kill people. So politicians have the power to narrow or widen general inequalities in society, and by consequence to narrow or widen health inequalities in society. Well, we go back to the issue of the fundamental causes. As I said, the fundamental causes of health inequalities are inequalities in income, wealth and power. And so to address those, we have to redistribute income across society. We have to narrow inequalities in general terms, which would therefore have an impact on narrowing health inequalities. And those powers exist. Powers around taxation of income, of wealth, of assets, alongside measures to protect the vulnerable and the poor in terms of a proper social security system, measures around poverty, around employment, around housing. All these things exist. Politicians have the power to do this. The question is whether they have the political will. A good but slightly different example of health inequalities within the UK lies with the issue of excess mortality in Glasgow. So this is around why Glasgow has such worse health than comparable cities in the UK, like Liverpool and Manchester. So to be clear, a huge part of the explanation for why health is poor in Glasgow relates to poverty and deprivation. Those are the main drivers of poor health in any society. And Glasgow has higher levels of deprivation than any Scottish city and is on a par with with the poorest of English cities. But even despite those very high levels of deprivation, it is much, much worse health than you would expect. And research has shown that premature mortality, that's deaths under the age of 65, is about 30% higher in Glasgow than in Liverpool, Manchester and also Belfast, cities with comparable levels of poverty and similar histories of deindustrialisation and a range of social challenges. And the most recent research into that has shown that the most likely underlying causes of that relate to a whole series of historical factors and political decisions which have had an adverse effect on the people of Glasgow over many, many decades. As a consequence of that, the population has been made more vulnerable to those drivers of poor health, poverty and deprivation, resulting in worse health. And the relevance of this is that, again, in understanding reasons for differences in health, this form of health inequality, it's around poverty, it's around deprivation, and it's around political decisions.